NDT by Lisa Cook, Julia Gomez, and Megan Vetter. Janet is a 60-year-old female who recently had a stroke which impacted her right side and is now experiencing right-sided spasticity in her upper extremity. In this video, you will see various NDT techniques to facilitate that typical movement pattern. We will be addressing her alignment, range of motion, posture, and weight shifting. In this first technique, I am guiding Janet to facilitate scapular range of motion. The first movement is scapular elevation. I will cue Janet to perform active shoulder elevation while I guide the scapula through the motions. This approach requires an occupational therapist to receive skilled training to ensure appropriate positioning and placement during the handling techniques. An example of this motion in occupation would be rolling your shoulders back to adjust your shirt over them when getting dressed. As you can see here, Janet's trunk is laterally flexed on her affected side and she is shifting most of her weight onto her unaffected hip. Here I will demonstrate handling techniques to facilitate a more neutral alignment in her spine. An example of this motion in an occupational function would be weight shifting and laterally flexing to perform toilet hygiene. As you can see here, Janet is displaying a slouched posture with a posterior pelvic tilt. I am utilizing handling techniques to facilitate an anterior pelvic tilt and extension of her lumbar region to improve her postural control. This is a motion you may see when preparing to stand up. The next technique is weight bearing into the affected upper extremity. This can be used as a facilitation or inhibition technique. This can be done while performing a functional task with the unaffected extremity and can incorporate weight shifting to the affected side. As you can see here, I am protecting her shoulder joint while we weight bear into her extremity. This next approach shows handling techniques to facilitate a sit to stand motion. As you can see, her ankles are slightly dorsiflexed and my leg is positioned over her affected leg to prevent buckling. And I am providing guidance at her lumbar region and sternal region to facilitate anterior pelvic tilt and thoracic extension, as well as addressing weight shifting. Here's an example of Janet actively weight bearing through her affected extremity during a functional task of retrieving items from the cupboard. As stated earlier, this can be used to facilitate or inhibit muscles, but it can also be used as a stabilizer with standing. Thanks for watching.